Good evening, I'm David Hale, and this is What If News. We are interrupting all scheduled programming to bring you a special report regarding an unusual disease outbreak that has occurred in several hospitals across the United States. At approximately 2:15 p.m. Eastern Time this afternoon, reports began coming in from multiple medical facilities in Atlanta, Georgia, describing patients exhibiting extreme violent behavior, unexplained aggression, and what can only be described as cannibalistic tendencies. We want to be very clear that we are still gathering information. These are preliminary reports. The Centers for Disease Control and Prevention has launched an investigation. We are asking you to remain calm while we provide you with accurate information as it becomes available. I am David Hale, and I will be here with Sarah Donovan throughout this special report.
I'm Sarah Donovan. We're going to walk you through what we know right now, and we're going to be honest about what we don't know. What we're hearing from hospitals in Atlanta is disturbing. Medical staff are describing patients who were admitted for what appeared to be a standard flu-like illness suddenly becoming violent. One nurse described a patient attacking her with what appeared to be inhuman strength. The patient had to be sedated. Another patient attacked another patient in the emergency room. Medical personnel are being treated for injuries. The hospitals are in a state of confusion. They don't understand what's happening, and frankly, neither do we at this point.
Let's establish a timeline. At 2:15 p.m., Grady Memorial Hospital in Atlanta began reporting unusual incidents in their emergency department. At 2:47 p.m., they reported that multiple patients were exhibiting violent behavior. At 3:10 p.m., the hospital called for additional security. At 3:45 p.m., the CDC was notified and an investigation was launched. At 4:22 p.m., similar reports began coming in from other hospitals in the Atlanta area. Emory Healthcare reported similar incidents. Northside Hospital reported similar incidents. We're now seeing a pattern. This is not isolated to one hospital. Multiple facilities are reporting similar phenomena simultaneously. That suggests a common cause. Something is making multiple patients violently aggressive.
We've been receiving calls from people in Atlanta, and they're describing panic in the streets. A woman named Patricia called our station and said that she saw something on the street that terrified her. She described a person who appeared to be injured, who was approaching other people on the sidewalk in an aggressive manner. She said the person had a blank expression on their face. She said the person seemed to be not quite human. I know that sounds dramatic, but that's what she said. She said it looked like something from a horror movie. Patricia was frightened enough that she locked herself in her car and called 911.
The CDC has issued a preliminary statement. Let me read it to you. The statement says the CDC is investigating reports of unusual behavior in several Atlanta area hospitals. Initial investigation suggests that affected patients may have been exposed to an unknown pathogen. The exact nature of the pathogen is unknown at this time. Hospitals are being advised to implement isolation protocols for affected patients. The public should remain calm and report any unusual symptoms to medical authorities. Further information will be released as it becomes available. That's the CDC statement. It's cautious, it's measured, but the underlying message is that they don't know what this is. They don't understand what's causing the behavior.
We're getting reports from Atlanta that the situation in the hospitals is becoming more chaotic. One hospital had to call police because multiple patients were becoming violent simultaneously. Police arrived at the hospital and found staff locked in offices trying to escape from patients. That's not normal. That's not something that happens in hospitals. Patients becoming so violent that staff have to hide from them. That suggests something very unusual. That suggests something very serious.
We need to address what people are speculating about online. Social media is already filled with speculation about what this could be. Some people are suggesting it's a drug. Some people are suggesting it's a toxin. Some people are suggesting things that sound like science fiction. Let me be clear, we don't know what this is. The authorities don't know what this is. And speculation is not helpful. What is helpful is accurate information. And what we know right now is that multiple patients in Atlanta are exhibiting violent behavior. The cause is unknown. The CDC is investigating. And we will provide you with updates as they become available.
We're now 3 hours into this situation. We've been receiving more reports and the situation seems to be escalating. A report came in 15 minutes ago that one of the violent patients escaped from a hospital. The patient was not physically restrained, so when the patient attempted to leave, staff were unable to stop them. The patient left the hospital and disappeared into the Atlanta street. That patient is potentially infectious. That patient is potentially dangerous, and that patient is now in the general population of Atlanta.
That's a significant development. We're now potentially looking at a public health threat that extends beyond the hospitals. We're looking at someone who may be infected with an unknown pathogen who is now loose in the community. The health department is being notified. Police are being dispatched. But finding one person in a city of 500,000 people is extremely difficult. Let me read another official statement. The Georgia Department of Public Health has issued the following statement. We are aware of the situation in Atlanta hospitals. We are investigating the cause. We are advising hospitals to implement heightened security measures. We are advising the public to report any unusual symptoms. If you observe someone exhibiting unusual aggressive behavior, please call 911 immediately. Do not approach such individuals.
That statement essentially confirms that they're worried about the spread of whatever this is. They're essentially saying that there may be more people out there who are affected. That's what report unusual aggressive behavior means, and they think there might be more cases. We're 4 hours into this situation, and we're moving from a hospital crisis to a potential public health crisis.
We're receiving reports from emergency rooms across Atlanta that patients are still arriving with flu-like symptoms. And some of those patients are developing the violent behavior. It's becoming clear that this is not a random event. This is a disease. People are getting infected with something, and that something causes violent behavior. The incubation period appears to be relatively short. Some patients are showing symptoms within hours of infection. We're potentially looking at something that spreads quickly.
I'm reading a message from a doctor named James who works at Grady Memorial Hospital. James writes, I've been a physician for 30 years. I've seen diseases, I've seen epidemics, but I've never seen anything like this. These patients are not acting like humans. Their eyes are different. Their facial expressions are wrong. They don't respond to stimuli the way normal people respond. They seem to be acting on pure instinct. It's like there's no consciousness there anymore. It's terrifying, and we don't have any idea how to treat it. Every treatment we try is ineffective. These patients are not responding to sedation. They're not responding to restraint. They're just violent.
That description is starting to paint a picture that sounds less like a normal disease and more like something that fundamentally affects the brain and nervous system. If the brain is being affected, if consciousness is being affected, then we're looking at a neurological disease. We're looking at something that damages the brain. And if the brain is being damaged, if the person is losing consciousness, then they might lose the ability to communicate, to reason, to show mercy. They might lose the ability to do anything except act on basic instinct. That's an extremely concerning scenario.
We're receiving reports of a second escaped patient. This one is from Emory Healthcare. The patient was being brought into the facility for treatment when they attacked a security guard and fled. The security guard is being treated for severe injuries. The patient is now in the community. That's 2 infected individuals now loose in Atlanta. We're looking at a potential containment failure. The hospitals can't contain their patients. The patients are escaping, and once they escape, they're in the general population where they can infect others.
The concept of containment is critical here. In infectious disease, containment is the process of isolating infected individuals so they cannot spread the disease. If containment fails, the disease spreads exponentially. The number of infected people doubles, then quadruples, then becomes unmanageable. We're now at 6 hours into this situation. If this is spreading and if containment is failing, we could be looking at an exponential growth in the number of infected people over the next 24 hours.
The Atlanta Police Department has issued an alert. The alert says that they are searching for 2 individuals who are considered dangerous. The alert describes unusual behavior. The alert warns the public to remain indoors. The alert warns the public not to approach these individuals. The fact that police are involved, the fact that a public warning has been issued, suggests that authorities are taking this very seriously. This is no longer just a hospital problem. This is a police matter. This is a public safety matter.
We're receiving reports that the number of new cases in Atlanta is accelerating. In the first hour, there were 4 cases. In the second hour, there were 8 cases. In the third hour, there were 15 cases. In the last hour, there were 23 cases. The number of new cases is doubling roughly every 90 minutes. If that rate continues, we'll have over 1,000 cases by tomorrow morning. We'll have tens of thousands of cases by tomorrow night. This is exponential growth. This is what an epidemic looks like in its early stages.
I'm receiving a message from someone named Marcus who works in the Atlanta Police Department. Marcus writes, we've been called to multiple hospitals now. We've been called to streets where people are reporting violence. We've been called to several 911 calls about people attacking each other. And every time we arrive, we see something that doesn't make sense. We see people who are not acting like normal humans. We're trying to subdue them, but they don't seem to feel pain. They don't seem to understand authority. They just attack. Several officers have been injured. We don't know what we're dealing with. We don't know how to handle this.
Police responding to violent calls is standard, but police encountering individuals who don't feel pain, who don't respond to authority, who continue to attack even when faced with armed officers, that's not standard. That's something different. That's something that police training hasn't prepared them for. If the infected individuals are not susceptible to pain, if they're not susceptible to fear, if they're not susceptible to the normal mechanisms of control, then traditional law enforcement responses might not be effective.
We're now at 7 hours into this situation. The CDC has announced that they're mobilizing a rapid response team to Atlanta. The response team will include epidemiologists, infectious disease specialists, and laboratory technicians. They're treating this as a potential epidemic. They're treating this seriously. But it's going to take time for the response team to get to Atlanta, set up operations, begin investigating the cause of the disease. Time that we don't have if the number of cases is doubling every 90 minutes.
We're receiving more information about the infected individuals who have escaped. Both individuals have been spotted multiple times in Atlanta, and both have attacked people. The first individual attacked a man at a bus stop. The man is being treated for severe injuries. The second individual attacked someone at a convenience store. That person is also being treated. So we're not just dealing with 2 loose infected individuals. We're dealing with 2 loose infected individuals who are actively attacking people. And each person they attack could potentially be infected.
That's the critical issue. If this disease is spread through contact, if it's spread through bites or scratches or blood contact, then each infected person who escapes could potentially infect dozens of others. And each of those people could then infect dozens more. Within days, you could go from 2 loose infected individuals to thousands of infected individuals. That's how epidemics spread. That's how pandemics start.
We're receiving a statement from the mayor of Atlanta. The statement says, "We are aware of the unusual situation occurring in our city. We are monitoring the situation closely. We are working with state and federal health authorities to investigate the cause and to implement appropriate containment measures. We are advising the public to remain in their homes until further notice. We are advising the public to avoid contact with unfamiliar individuals who display unusual behavior. Further updates will be provided as they become available." The mayor is advising the public to remain in their homes. That's a significant step. That's essentially saying that there's danger in the streets. That's essentially saying that people should not go outside.
We're receiving reports of more escapes. A third infected individual escaped from a hospital. And now there are reports of infected individuals in multiple locations across Atlanta. They're not just in one area, they're spreading throughout the city. The situation is becoming less contained. The situation is becoming more dangerous. And the authorities seem to be losing control of the situation.
We're now 8 hours into this situation. The case count has reached approximately 217 confirmed infected individuals. The rate of new cases is still accelerating. If the exponential growth continues, we could have over 400 cases by 10 hours. We could have over 800 cases by 12 hours. We could have thousands of cases by 24 hours. This is becoming a major epidemic in Atlanta, and if it spreads beyond Atlanta, it becomes a regional epidemic. And if it spreads beyond the region, it becomes a national epidemic. And if it spreads nationwide, it becomes a pandemic.
I'm reading a message from a woman named Jennifer in Atlanta. Jennifer writes, I'm locked in my apartment with my family. We've barred the door. We've locked all the windows. We heard screaming outside about an hour ago. We've heard what sounds like violence. We heard sirens. We don't know what's happening out there. The news keeps saying to stay inside, but it doesn't say what to do if the infected people come to your door. It doesn't say what to do if they attack your home. I'm terrified. My children are asking what's happening, and I don't have an answer for them.
People are scared, and appropriately so. We're looking at a situation where an unknown disease is rapidly spreading in a major American city. We're looking at infected individuals who are violent and seemingly unstoppable. We're looking at authorities who don't understand the disease and don't have effective treatment. We're looking at a breakdown of normal order in a major city. That's a scenario that naturally produces fear.
We're receiving reports of police establishing roadblocks around certain areas of Atlanta. The police are trying to prevent infected individuals from spreading into unaffected areas of the city. They're trying to establish a perimeter, but the infected individuals seem to be difficult to stop. One report describes an infected individual running directly at a police line and being shot multiple times by officers. The infected individual did not stop. The infected individual did not appear to feel the bullets. The infected individual had to be tackled and restrained by multiple officers.
That's a crucial piece of information. If infected individuals are not affected by bullets, if they're not deterred by firearms, then traditional law enforcement tactics become ineffective. Shooting someone is normally an effective way to stop them, but if the infected individual doesn't feel the pain, if they don't have a normal physiological response to being shot, then shooting them might not stop them. That's a major problem for public safety officials.
We're 9 hours into this situation. The infection is moving beyond Atlanta. We're receiving reports of cases in surrounding areas. A hospital in Marietta, Georgia, which is about 30 kilometers north of Atlanta, is reporting cases of the same disease. A hospital in Augusta, Georgia, which is about 200 kilometers east of Atlanta, is reporting similar cases. The infection is spreading geographically. It's spreading beyond Atlanta. It's moving throughout Georgia.
This is the moment when a localized outbreak becomes a regional epidemic. This is the moment when authorities move from trying to contain a local situation to dealing with a regional problem. The Georgia Department of Public Health is now mobilizing resources throughout the state. The National Guard is being considered for deployment. We're moving from normal public health response to emergency response. We're moving toward a state of crisis.
The CDC has issued a new statement. The statement says the CDC is treating this as a potential public health emergency of national concern. The cause of the illness remains unknown. However, initial analysis suggests that the disease may be spread through direct contact and potentially through bites or scratches from infected individuals. We are advising all hospitals nationwide to implement strict isolation protocols for patients with symptoms, including unexplained aggression, violent behavior, and altered mental status. We are advising the general public to avoid contact with individuals displaying these symptoms. We are advising people in affected areas to remain indoors. Further guidance will be provided as we learn more about this disease.
That statement is significant. The CDC is now treating this as a national emergency. The CDC is advising hospitals nationwide to be prepared for cases. The CDC is suggesting that this could spread beyond Georgia. The CDC is suggesting that this could become a national problem. This is no longer a local crisis. This is a national crisis.
We're receiving reports of a shooting at a hospital in Marietta. An infected individual attacked a hospital worker, and that attack was met with lethal force. The infected individual was shot multiple times. The infected individual did not die. The infected individual continued to attack. Eventually, the infected individual was subdued and restrained. But the officer who shot the infected individual is describing something that sounds impossible. The officer is saying that the infected individual seemed to be acting from pure instinct, that the infected individual showed no sign of consciousness or awareness, that the infected individual seemed to be more like an animal than a human being.
That description is becoming more common. Infected individuals seem to have lost higher brain functions. They seem to be acting on base instinct. They seem to be driven by hunger or aggression or both. They seem to have lost the aspects of consciousness that make us human. If that's true, if the infection is causing a fundamental change in consciousness, then we're not dealing with a disease in the traditional sense. We're dealing with something that transforms people into something else, something fundamentally different.
We're now 10 hours into this situation. The confirmed case count has reached approximately 583. We're receiving reports of cases in 7 different Georgia cities. We're receiving reports of cases in South Carolina. We're receiving reports of cases in Tennessee. The infection is spreading beyond Georgia. It's becoming a multi-state phenomenon. The growth rate is still exponential. We're looking at a situation that's growing completely out of control.
We need to talk about what happens if this continues to spread at this rate. If we double the number of cases every 90 minutes, if we have 500 cases at 10 hours, then we'll have approximately 1,000 cases at 12 hours, 2,000 cases at 14 hours, 4,000 cases at 16 hours. By midnight tonight, we could have tens of thousands of infected individuals spread across multiple states. By tomorrow morning, we could have hundreds of thousands. By tomorrow night, we could have millions. At that point, containing this becomes impossible. At that point, traditional public health interventions become ineffective. At that point, we're looking at a pandemic.
I'm reading a message from a man named Robert, who is a hospital administrator in Savannah, Georgia. Robert writes, "We're starting to see cases here now. We're preparing isolation wards. We're preparing for the possibility that this could overwhelm us. But I'm not confident that isolation will work. I'm not confident that we'll be able to contain the infected individuals if they become violent. Our security personnel are not trained for this. Our hospital infrastructure is not designed for this. I'm afraid that we're not prepared. I'm afraid that when the infected individuals arrive in large numbers, we won't be able to handle it. I'm afraid that people are going to die because we're not equipped to deal with this."
That fear is justified. Hospitals across the country are not prepared for an epidemic of this magnitude. They don't have the beds, they don't have the equipment, they don't have the personnel, and they don't have any idea how to treat this disease because nobody knows what causes it. The CDC is still investigating. The cause is still unknown. Hospitals are being asked to treat something that they don't understand with tools that don't work.
We're receiving reports of infected individuals in Atlanta attacking people on the streets. We're hearing reports of attacks in downtown Atlanta, in midtown Atlanta, in neighborhoods throughout the city. Police are overwhelmed. Calls for help are not being answered promptly because police resources are stretched thin. Emergency rooms are overflow with patients. Ambulances are unable to respond to all calls. The infrastructure is becoming overwhelmed. Order is beginning to break down.
This is the moment when a crisis becomes a catastrophe. This is the moment when the institutions that we depend on start to fail, when police can't respond to calls, when ambulances can't arrive, when hospitals can't take patients, when the social contract breaks down, society begins to fail. People stop trusting institutions. People start taking matters into their own hands. Panic spreads. Chaos emerges.
We're 11 hours into this situation. Reports are coming in from multiple cities across the Southeast. Atlanta is in crisis, but it's not just Atlanta anymore. Jacksonville, Florida is reporting cases. Charlotte, North Carolina is reporting cases. Nashville, Tennessee is reporting cases. The infection is spreading rapidly across the Southeast. It's spreading far faster than authorities anticipated. It's spreading far faster than can be contained. It's spreading like a wildfire.
We need to address something directly. At this rate of spread, with cases now appearing in multiple states, with exponential growth continuing unabated, we are now looking at the beginning of a pandemic. This is not a regional emergency anymore. This is becoming a national emergency. Within 48 hours, we could have cases in every state. Within a week, we could have millions of infected individuals. This is moving faster than any public health authority anticipated or prepared for.
The president has been briefed on the situation. The president is aware of the crisis. We're waiting for a presidential statement. The government is mobilizing federal resources, but federal resources take time to deploy, and time is the one thing we don't have. The infection is spreading in real time. It's spreading as we speak. Federal responses won't be effective if they arrive after the situation has already exploded into chaos.
We're receiving intelligence that the infection might not be naturally occurring. Some analysts are suggesting that this might be a deliberate biological weapon. Others are suggesting that this might be the result of a laboratory accident. Still others are suggesting that this might be a naturally occurring disease that has mutated or jumped from animals to humans. The cause is still unknown, but some are wondering if the speed and pattern of the outbreak suggests something other than a natural disease.
We're 12 hours into this situation. The confirmed case count has exceeded 1,000. The real number is probably significantly higher because not all cases are being reported or confirmed. We're probably looking at several thousand infected individuals at this point, maybe tens of thousands. We don't know. The reporting is becoming overwhelmed. Hospitals are too busy treating patients to report statistics. Health departments are too busy managing the crisis to track numbers. We're operating with incomplete information. We're flying blind.
We're receiving reports that the National Guard is being mobilized in Georgia. The President has authorized deployment of military forces to help restore order in affected areas. National Guard troops are being sent to Atlanta, to Savannah, to other affected cities. They're being deployed to provide security, to establish order, to help with medical response. But the National Guard is not trained for pandemic response. They're trained for security and order maintenance. And order is something that's becoming increasingly difficult to maintain.
I'm reading a message from a woman named Sarah who is in Atlanta. Sarah writes, I can see National Guard troops moving through the streets. They have weapons, they have armor, but I don't think weapons and armor help against what's happening. I've seen people bite National Guard soldiers. I've seen people attack in ways that don't make sense. They don't retreat when threatened. They don't show fear when faced with weapons. It's like they're not human anymore. The National Guard soldiers look terrified. They're trained to fight humans, but this is something different. This is something that doesn't follow human rules.
That's becoming the consistent description. Infected individuals are described as not human anymore. They're described as acting on pure instinct. They're described as not responding to threats in the way that normal humans respond. If they're not acting like humans, if they're not responding to incentives like pain or fear or authority, then all of our traditional methods of control become ineffective. Guns become less effective, restraints become less effective, authority becomes meaningless. We're dealing with something that doesn't follow human rules.
We're receiving reports of mass infection events. In one hospital in Jacksonville, approximately 60 patients became infected simultaneously. It happened over the course of a few hours. All of them displayed the same violent behavior. All of them had to be restrained. The hospital was overwhelmed. This is not slow transmission. This is rapid transmission. This is transmission that's happening in hospitals where infected individuals are in close proximity to uninfected people.
Hospital-based transmission is extremely dangerous. Hospitals are where vulnerable people are concentrated. Hospitals have patients with weak immune systems, patients who are already ill, patients who are more susceptible to infection. If the infection spreads through hospitals, if it takes hold in the healthcare system, then hospitals become sources of infection rather than places of healing. The entire healthcare system becomes compromised. That's a catastrophic scenario.
We're 13 hours into this situation. The nationwide case count is now confirmed at over 2,000, but the real number is certainly much higher. We're probably looking at somewhere between 5,000 and 20,000 infected individuals nationwide at this moment. The growth rate is still exponential. The infection is still spreading rapidly. We're moving toward a situation where we lose the ability to count the number of infected people because there are simply too many.
We're receiving reports that the infection has reached the West Coast. A case has been confirmed in San Francisco. A case has been confirmed in Los Angeles. Cases have been confirmed in Portland. The infection has spread across the entire continental United States in 13 hours. It's in every region now. It's in every major population center. This is no longer a regional epidemic. This is a nationwide epidemic. This is a pandemic in the United States.
The president has addressed the nation. Let me read the statement for you. The president said, "My fellow Americans, we face an unprecedented crisis. An unknown infectious disease is spreading rapidly across our nation. It is causing violent and aggressive behavior in those it infects. The exact cause is unknown, but the CDC and every federal agency is working around the clock to understand it and to develop treatment. I am declaring a state of emergency in all 50 states. The National Guard is being mobilized nationwide. I am urging all Americans to remain in their homes. I am urging you to avoid contact with others. I am urging you to follow all public health guidance. We will overcome this challenge. We will restore order. We will defeat this disease. God bless America. That's the presidential statement. It acknowledges that the situation is nationwide. It acknowledges that we're in a state of emergency.
The fact that the president is declaring a nationwide state of emergency is a recognition that normal governmental structures are inadequate to deal with this situation. It's a recognition that we're entering a state of crisis that requires extraordinary measures. It's a recognition that this is not just a public health emergency, this is a national security emergency. The military is being mobilized, military resources are being deployed. We're moving toward a military response to what is essentially a public health problem.
We're 14 hours into this situation. The situation in major cities is deteriorating rapidly. In Atlanta, there are reports of infected individuals roaming streets in groups. There are reports of attacks on uninfected people. There are reports of people barricading themselves in buildings. There are reports of violence and chaos. The normal structures of urban life are breaking down. People are panicking. People are fleeing. People are arming themselves. Society is starting to unravel.
We need to talk about what's likely to happen in the next 24 hours. If the current growth rate continues, if we're doubling the number of cases every 90 minutes, then we'll have somewhere between 50,000 and 200,000 infected individuals by this time tomorrow. That's enough to overwhelm every hospital in the country. That's enough to overwhelm every law enforcement agency. That's enough to create chaos in every major city. Within 24 hours, we could be looking at a complete breakdown of social order in the United States.
I'm receiving messages from people across the country. A man named Tom in New York writes, I can see police and National Guard mobilizing. I can see people buying weapons and supplies. I can see people fleeing the cities. There's panic, there's fear. People are preparing for something. Nobody knows exactly what, but everyone senses that something terrible is coming. A woman named Lisa in Los Angeles writes, I've seen infected people, and I've seen what they do. I've locked myself in my apartment, and I'm not leaving. I don't trust the police to protect me. I don't trust the government to help me. I'm on my own now.
People are losing trust in institutions. People are taking matters into their own hands. People are arming themselves. People are isolating themselves. People are preparing for the worst. This is what panic looks like when it spreads nationwide. This is what happens when people believe that social order is breaking down. And the problem is that social order actually is breaking down. Their fear is justified.
We're 15 hours into this situation. The case count has officially exceeded 5,000 confirmed cases, but that number is almost meaningless at this point. The real number is probably in the tens of thousands. Hospitals are not even trying to track numbers anymore. They're just trying to manage the patients they have. Healthcare workers are being infected. The healthcare system is being compromised from within.
Healthcare worker infections are critical. When doctors and nurses and hospital staff become infected, the hospital becomes dysfunctional. Hospitals need staff to function. If the staff is being infected, if the staff is becoming violent and need to be restrained, then the hospital can't function. Patients can't be treated. The entire system fails. We're seeing this happen in real time right now.
We're receiving reports of hospitals being abandoned. In one city, a hospital was evacuated because the number of infected individuals exceeded the hospital's capacity to manage. All patients, infected and uninfected, were evacuated. The hospital is being locked up and abandoned. This is happening in a major American city. This is not a hypothetical scenario. This is happening right now.
Hospital abandonment means that sick people have nowhere to go. Injured people have nowhere to go. People in crisis have nowhere to go. The safety net is disappearing. The institutions that we depend on are failing, and they're failing in real time. Within 24 hours, we could see hospital abandonment in every major city. We could see the complete failure of healthcare infrastructure nationwide.
We're 16 hours into the situation. Reports are coming in of mass gatherings of infected individuals. In one location in Atlanta, over 200 infected individuals have gathered together. They're moving as a group. They're attacking people. They're consuming people. I say that word with hesitation because we haven't confirmed it officially, but multiple witnesses are describing infected individuals eating uninfected people. That's cannibalism. That's behavior that suggests the infected are driven by hunger. That's behavior that is almost impossible to comprehend.
If the infected are engaging in cannibalism, if they're driven by hunger, then they're being driven by a fundamental biological drive. That's consistent with what we've been hearing from people who have encountered the infected. They're acting on base instinct. They're driven by hunger and aggression. They're not capable of higher reasoning. They're not capable of empathy. They're not capable of stopping. They're going to continue attacking and consuming until they're either stopped or they run out of prey.
We're receiving a military briefing. Let me read it. The military briefing states the infection rate is exceeding all projections. Current estimates suggest that we are looking at exponential growth that, if unchecked, will result in infected outnumbering uninfected within 72 hours. The infected are exhibiting violent and cannibalistic behavior. They appear to be a threat to all uninfected humans. The military is preparing for the possibility of major conflict with infected populations in major cities. We are preparing for urban warfare. We are preparing for scenarios where we're fighting in the streets against infected populations.
The military is preparing for urban warfare. Let that sink in. The United States military is preparing to conduct military operations inside American cities against infected populations. We've gone from a public health emergency to a military crisis in just 16 hours. We're at a point where the military is being called on to conduct combat operations. That's a sign of complete institutional failure. That's a sign that we've lost the ability to manage this through normal channels.
We're 17 hours into this situation. The situation in multiple cities is now being described as out of control. In Atlanta, infected individuals are roaming streets in large groups. Police and National Guard are overwhelmed. They can't contain the infection. They can't prevent attacks. They're essentially fighting a losing battle against an enemy that keeps growing. One National Guard commander described it as fighting an enemy that increases in numbers every time you kill one of them because every person they attack becomes infected.
That commander's right. Every attack creates new infected individuals. Every new infected individual increases the pressure on the system. Every increase in pressure causes the system to fail further. This is a geometric growth pattern. This is growth that accelerates beyond the capacity of any system to manage. Within hours, we could be looking at a situation where infected outnumber uninfected in major cities. And when that happens, the survival of uninfected people becomes a matter of individual survival, not institutional survival.
We're receiving reports of mass evacuation from major cities. People are fleeing, they're getting in cars and leaving. They're trying to reach smaller towns and rural areas where the infection hasn't spread yet. But in doing so, they're potentially spreading the infection. People who are infected but don't realize they're infected are driving to new locations. They're spreading the disease to new areas. The evacuation itself is accelerating the spread of the infection.
This is a classic pandemic response problem. When people panic, when they flee, they spread the disease. The normal public health response would be to quarantine people, to prevent them from moving. But quarantine requires order and authority. Order and authority are breaking down. The government can't enforce quarantine. People are fleeing, and in fleeing, they're accelerating the pandemic. This is a scenario that epidemiologists have warned about for decades. This is exactly what they predicted would happen.
We're 18 hours into this situation. The confirmed case count is now over 10,000. But the real number is probably in the hundreds of thousands. We're at a point where we don't even know how many people are infected. We're operating with almost no information. We're making decisions with no knowledge of the actual scope of the crisis. We're essentially flying blind.
Flying blind is appropriate. We don't know what causes this disease. We don't know how to treat it. We don't know how it spreads. We don't know how many people are infected. We don't know anything. The only thing we know is that it's spreading rapidly, that infected people are dangerous, and that the normal structures of society are failing to contain it. Beyond that, we're operating on guesses and speculation.
The CDC has issued a new statement. The statement says, the CDC is recommending that all non-essential personnel evacuate major metropolitan areas. The CDC is recommending that people in affected areas shelter in place in secure locations. The CDC is recommending that all infected individuals be isolated. However, the CDC acknowledges that isolation may not be possible given the current rate of spread. The CDC is recommending that people prepare for the possibility that institutional response may not be available. The CDC is recommending that individuals take measures to ensure their own survival and the survival of their families.
That statement is essentially an admission of defeat. The CDC is admitting that it can't contain the outbreak. It's admitting that institutional response will fail. It's essentially telling people to prepare to survive on their own because the government can't help them. That's an extraordinary statement from the CDC. That's an acknowledgement that the situation is beyond institutional capability to manage.
People are taking that statement to heart. We're seeing massive migrations from major cities. We're seeing highways clogged with traffic. We're seeing chaos at gas stations and supply stores. People are trying to get supplies. People are trying to reach safety, but safety is becoming harder to find. The infection is everywhere. People are leaving the cities and potentially carrying the infection with them.
We're 19 hours into this situation. We're approaching the point where we've gone a full day into this crisis. In that time, we've gone from a localized hospital emergency to a nationwide pandemic. We've gone from trying to contain the infection to admitting that containment is impossible. We've gone from normal institutional response to military mobilization. We've gone from public health emergency to national crisis. This has been one of the fastest escalations in human history.
I'm receiving messages from people who are frightened and desperate. A man named David writes, I'm with my family. We're barricaded in a basement. We can hear people outside attacking each other. We can hear screams. We can hear the sound of violence. We don't know if we're going to make it. We don't know if we're going to survive. We're just trying to stay alive until the government figures out how to stop this. But I'm beginning to wonder if the government can stop this. I'm beginning to wonder if anything can stop this.
That man's fear is justified. The government has not stopped this. The military has not stopped this. Medicine has not stopped this. The infection continues to spread. The infected population continues to grow. The uninfected population continues to flee and die. Nothing has been effective. Nothing has slowed the growth. We're watching something that is essentially unstoppable.
We're receiving reports that the military is considering using nuclear weapons. I say that with caution because this is unconfirmed, but military sources are suggesting that there is discussion at the highest levels of government about using nuclear weapons to sterilize major population centers. The idea would be to destroy infected populations in major cities before they can spread further. That would require dropping nuclear weapons on major American cities. That would require destroying millions of people, both infected and uninfected, to potentially stop the spread of the infection.
The use of nuclear weapons against American cities is almost impossible to imagine. But if that's being discussed at the highest levels of government, it suggests how desperate the situation has become. It suggests that authorities believe the infection is so dangerous, so uncontrollable, that nuclear weapons might be considered as an option. And that's a sign of complete crisis. That's a sign that nothing else is working.
We're 20 hours into this situation. The confirmed case count is now over 50,000. The real number is probably in the millions. The infection has spread to every state. The infection is in every major city. The infection is in smaller towns and rural areas. It's everywhere, and it's growing exponentially. Within 24 hours, if the growth rate continues, we could have tens of millions of infected individuals in the United States.
Tens of millions of infected individuals would mean that the infected outnumber the uninfected. It would mean that America has been conquered by the infection. It would mean that the structure of civilization has failed. It would mean that organized government response becomes impossible. We're possibly hours away from that moment. We're possibly hours away from the complete collapse of organized society in America.
We're receiving reports that some governments are considering a nuclear option, not just against American cities, but internationally. South Korea is discussing the possibility of using nuclear weapons against infected zones. Australia is discussing the possibility of nuclear strikes. Russia is discussing the possibility of nuclear weapons. Multiple nations are considering the use of nuclear weapons to sterilize infected zones. We're moving toward a scenario where multiple nations are using nuclear weapons to contain the spread of the infection.
Using nuclear weapons to contain a biological outbreak is a sign of absolute desperation. It's a strategy of last resort. It's an acknowledgement that there is no other way to stop the spread. If multiple nations use nuclear weapons, we're looking at potential global nuclear war. We're looking at a scenario where the infection causes the collapse of nuclear restraint. We're looking at a scenario where the infection leads to nuclear annihilation as nations try to stop its spread.
We're 21 hours into this situation. The situation is deteriorating across the globe. China is reporting massive outbreaks in Beijing and Shanghai. India is reporting massive outbreaks in Mumbai and Delhi. Japan is reporting outbreaks in Tokyo. Europe is reporting outbreaks in every major city. Africa is reporting outbreaks. The infection has spread globally. Within 21 hours, the infection has gone from an Atlanta hospital to a global pandemic.
That's the fastest pandemic spread in human history. It's faster than COVID-19. It's faster than any previous pandemic, and it's not slowing. The infection is spreading faster globally than it did initially in Atlanta. This suggests that the infection has become normalized in the global population. People are no longer shocked by it. People are no longer following safety protocols. The infection is spreading through a population that is increasingly in panic and increasingly non-compliant with safety measures.
We're receiving reports that governments are implementing nuclear strikes against infected zones. I need to say that clearly. Governments are using nuclear weapons to try to sterilize infected areas. Russia has reportedly used a tactical nuclear weapon against Moscow. China has reportedly used nuclear weapons against Beijing. India has used nuclear weapons against Mumbai. Multiple nations are using nuclear weapons. We're in nuclear war. We're at the point where multiple nations are conducting nuclear strikes.
Nuclear strikes against cities would kill millions of people, both infected and uninfected. The use of nuclear weapons against Moscow, Beijing, Mumbai, and other cities suggests that nations believe the infection is so serious that a nuclear annihilation is preferable to infection. That's an extraordinary calculation. That's the calculation of a civilization that is facing extinction. That's the moment when institutions decide that civilization is worth destroying to avoid the infection.
We're 22 hours into this situation. The world is in crisis. Multiple cities are in ruins. Tens of millions are infected. Tens of millions are dead from both the infection and the nuclear strikes. The global economy has collapsed. Supply chains are broken. Communication networks are breaking down. There is no longer any coordination between nations. There is only chaos. There is only survival.
We're now at the point where the larger picture becomes clear. We're looking at the possibility of human extinction. If the infection spreads unchecked, if the growth continues exponentially, if there is no effective treatment, then the infection will spread until there are no uninfected humans left, or the infection will continue until so many nuclear weapons have been used that the environment is destroyed. Either way, we're looking at the end of human civilization. We're looking at the end of organized society. We're looking at the end of the world as we know it.
I need to acknowledge something personally. This is Sarah Donovan. I'm sitting in this newsroom and I'm terrified. We're reporting on the end of the world. We're reporting on the collapse of civilization. And I'm trying to maintain professional composure while watching everything end. I've been a journalist for 25 years. I've reported on disasters, on tragedies, on human suffering. But I've never reported on the end of the world. I've never reported on something this big, this final, this absolute. And
this is David Hale. I'm also terrified. We're at a point where the normal role of journalism becomes almost meaningless. Journalists are supposed to inform the public so they can make informed decisions. But there are no decisions left to make. There is no future to plan for. There is only the present moment of survival. We're beyond the point where information is useful. We're at the point where we're bearing witness to the end. That's all we can do. That's all anyone can do.
We're 23 hours into this situation. The situation is essentially over. Organized society is finished. Military operations are broken down. Government is broken down, healthcare is broken down, supply chains are broken down. The only things that remain are isolated pockets of uninfected humans trying to survive. The infection has won, the infection has conquered the world, and within 24 hours, it has done it.
The final statistics are becoming clear. The number of infected humans exceeds 500 million globally. The number of deaths from the infection is estimated at approximately 200 million. The number of deaths from nuclear strikes is estimated at approximately 300 million. The combined death toll is approximately 500 million people. That's roughly 7% of the global population dead in 24 hours. The surviving human population is approximately 7.5 billion people, most of whom are infected or in the process of being infected.
Organized military response has failed. The last military installations are either being abandoned or are no longer in communication with higher command. Police forces have either abandoned their posts or have been infected and turned into part of the infected population. Hospitals are non-functional, schools are non-functional, governments are essentially non-functional. The structures that civilization depends on are gone. They lasted 24 hours in the face of the infection, and then they failed.
We are still broadcasting. We are still here. We are still trying to report on what's happening. But I need to be honest. I don't know how much longer we'll be able to broadcast. Power is failing. Communication systems are failing. The infrastructure that allows us to broadcast is deteriorating. Within a few hours, this broadcast will likely end. When it ends, there will be no more news, there will be no more coordination, there will be no more organized information, there will only be silence.
I want to address the people who are still listening. If you're listening to this, you are one of the survivors. You are one of the humans who is still uninfected at this moment. But you need to understand that you are likely in a minority. You are likely surrounded by infected individuals. You need to shelter in place. You need to isolate yourself from other people. You need to assume that every person you encounter is infected. You need to survive. That's all that remains. Survival, individual survival, family survival, small community survival.
For those of you who are infected, I want to acknowledge that you are also human. At some point you were not infected. At some point you were like everyone else. The infection changed you. It changed who you are at a fundamental level. I don't know if there's any consciousness left in you, any awareness of what you've become, but I want to acknowledge that the infected are also victims of this catastrophe. You didn't choose to be infected. This happened to you, and I'm sorry. I'm sorry that this happened to you.
We're now at the 24-hour mark. It's been exactly 1 day since this began, 1 day since the first reports came out of Atlanta. In that 1 day, we've gone from a hospital crisis to the collapse of civilization. We've gone from a localized outbreak to a global pandemic. We've gone from organized government response to nuclear war. We've gone from trying to save people to trying to survive. In 24 hours, the world has fundamentally changed. The world we knew yesterday no longer exists.
This is the final broadcast of What If News for the foreseeable future. We will no longer have the power to broadcast. We will no longer have the communication infrastructure to reach the public. We will no longer have the organizational capability to continue operations. This is the end of coordinated news reporting. This is the end of institutional communication. This is the end of the broadcast era.
To the survivors, to those who are listening, to those who are planning to continue living, you are now on your own. There is no government to help you. There is no military to protect you. There is no healthcare system to heal you. There is only you and your community. You need to work together. You need to help each other. You need to maintain whatever shred of human civilization remains. You need to remember that you are human, that your communities are human, that humanity survives in small acts of kindness and cooperation. That's all that remains.
We are ending this broadcast. Sarah and I will remain in this station for a few more hours until the power fails and we can no longer operate. After that, we will attempt to reach safety. We will attempt to survive. We will attempt to remain human in a world that has become inhumane. We will attempt to maintain hope in a situation that seems hopeless. That's all we can do. That's all anyone can do.
This is Sarah Donovan for What If News. We're signing off.
This is David Hale. Stay safe, stay alive, and remember that you are human.